An ethical deep dive, cash bribes, and swift appointments in strained healthcare. In a world where healthcare systems are strained, a disturbing trend has surfaced. It's a trend that raises serious ethical questions and demands our attention. Picture this, a family doctor trained overseas working in a system overwhelmed with patients. The waiting times are long, the pressure is immense. Then an offer is made, an envelope of cash, a patient desperate for an earlier appointment. The doctor's tempted, the patient is desperate. A compromise is made. But what does this mean in the grand scheme of things? How does this impact the healthcare system and the society we live in? This isn't just about the doctor's ethical compass. We must look beyond to the systemic issues that led to this point. The healthcare system is underfunded, overworked, and overlooked. Doctors struggle to cope, patients are left waiting. In this context, it can be easy to villainize the doctor, but is it fair to do so? When systemic issues force professionals into moral corners, the problem is not just individual, it's institutional. Long waiting times are not just an inconvenience. They impact patient care, they affect outcomes. Patients are left frustrated, anxious, and desperate. In their desperation, they turn to illicit alternatives. But what happens when the illicit becomes prevalent? When cash bribes become the norm rather than the exception? This practice not only undermines the fairness of the system, but also erodes public trust in healthcare. It sets a dangerous precedent, one where money can buy quicker care. Quality healthcare should be accessible to all, not just those who can pay. Moreover, it risks the devaluation of the doctor-patient relationship. Trust, honesty, and mutual respect, these are the foundations on which this relationship is built. When money enters the equation, these foundations are shaken. The doctor becomes a service provider, the patient a customer. This perspective is problematic. It commodifies healthcare, narrows it down to transactions rather than compassionate care. Indeed, the ethical implications of this practice are far-reaching. They challenge our collective understanding of right and wrong. But where do we go from here? How can we address this issue? Change must begin at the institutional level. Healthcare systems need to be reevaluated, resources reallocated. Waiting times need to be addressed. More staff, more funding, more focus. Doctors should be supported, not driven to compromise their ethics. Patients should be served, not forced to barter for care. Education about ethics is critical too. It's not enough to know about the Hippocratic Oath. It needs to be lived. Regulations should be enforced more strictly, but not without addressing the reasons behind their breach. And the public must be engaged in this conversation too. Awareness, dialogue, and understanding are essential. Healthcare is a fundamental right. It's not a privilege to be bought, not a benefit to be bargained for. This video aims to shed light on this dire issue. It's a plea for attention, for action, for change. Because in the end, it's not just about one doctor, one patient, one bribe. It's about our society, our values, our collective health. This is a call to scrutinize, to question, to act. Because healthcare should be about care, not cash. And the time to address this ethical dilemma is now. So let's start the conversation. Let's question the status quo. Let's strive for a more ethical, more equitable healthcare system. Because in the end, our health, our ethics, our society, they are all interconnected. They are all worth fighting for.